This critical appraisal is on diagnostic accuracy of clinical tests for subacromial impingement syndrome. This is a systematic review and meta-analysis. So the search study was from the slides of the MSK slides by the author in the year of one that was missing a critical appraisal. The objective of the critical or the meta-analysis was to examine the accuracy of clinical tests for diagnostic subacromial impingement syndrome. The patients that were used all had to be at or above 16 years old, presenting with painful shoulder suspected of SIS. 21 different clinical shoulder examination tests were used, example stuff like NIRS, Hawkins-Kennedy, MDCAN, stuff like that. The comparison was a surgical diagnosis, arthroscopy, or open surgery to confirm the SIS stages, whether it was 1, 2, or 3. And then that included partial or full thickness rotator cuff tears. The O is diagnostic accuracy of each clinical test expressed as sensitivity, specificity, likelihood ratio, and pooled estimates across studies. Level of evidence is 1, and the study design is a systematic review and meta-analysis. The studies included ranges from sizes of over 4,000 to just over 500 patients. Inclusion of the studies were included if they met the following criteria. So their study design, a prospective or retrospective cohort study, and their patient population, and they had to have adult patients at or over the age of 16 with painful shoulder. They had to have any index tests containing in the table 1 reported on the meta-analysis, and then setting of care had to be inpatient in outpatient setting, so it didn't discriminate against that. And the reference test had to have some sort of surgery, either arthroscopy or open surgery, findings to include the presence of an enlarged or fibrotic appearing tendons. And the exclusion criteria was just based off of the title alone, based on what the meta-analysis stated. The methods was a literature search conducted from 2011 of January of 2011, and including the following engines. So they use several different databases. The studies had to show number of true positive, false positives, and all of that stuff for each clinical test, and they were pulled from the studies and put into a 2x2 table. And then the quality of selected studies were assessed using the Quadis diagnostic accuracy tool, and this was done by 2 people that were trained to do this. And it was also included studies, like I talked about earlier, of the range of patients. 21 different clinical tests were conducted to examine their rotator cuff integrity, which were used most of the most common tests that were listed below. Some included NIRS, Hawkins-Kennedy, and MDCAN, and then it just is specifying which ones were used how many times. And then a description of these tests were detailed in Table 3 in the article. 10 studies with about 1,600 patients were included in the meta-analysis. Diagnostic values are below, so it has high specificity, and which correlates to a good high positive likelihood ratio, and then a not great sensitivity, which correlates to a bad negative likelihood ratio. The diagnostic accuracy is right here. It's just comparing other studies that looked at rotator cuff pathologies, rotator cuff tests, mainly looking at subacromial impingement. Oh. And then the results are here. So yielded just over 1,000 articles, in which the publications were excluded based on their title or abstract. 16 of the remaining 31 articles met the inclusion criteria and were selected for the review. The liftoff test provides strong evidence to rule in SIS, and then when the test is positive. Accurate clinical diagnosis of SIS may serve as a reduction of number of unnecessary referrals. So this is a Prisma attached. And then take-home points are just that the liftoff provides good, strong evidence to rule in SIS when the test is positive, and then also showing that a whole battery of tests for subacromial impingement syndrome may serve well in reducing number of unnecessary referrals to doctors or surgeons.